Ms. Gonzalez, for what purpose?
Does the gentleman yield?
Gentleman yield for questions?
Yes.
Gentleman yields.
Mr. Leach, and I'm a member of the insurance committee, as you remember when you laid out your bill, and I made it very clear, right, that nobody wants to deny health coverage to anyone, right? I mean, this is not if there's a person who decides to detransition, whether it's by choice or whether it's because they really have no other option, right? Especially like it's more senior citizens who are trans that run into this issue. Of course, we want folks to be able to get health care, right? The issue that concerns me and that I brought up in committee is the fact that the potential of this bill to increase insurance costs, right? And in the insurance committee, that the chairman there has made that this is one of our goals this session, right? Mr. Speaker, it's hard for me to even hear myself back here. Thank you.
Members, please take your conversations outside the rail.
And so that's one of my primary concerns, is that it's going to have an impact on everybody else, right? Because now insurance companies are going to have to cover these other procedures that may or may have not been originally covered or paid for by an enrollee. In the committee sub that's currently before us, added language from your original bill that added language that said, even if an insurance company has ever offered gender affirming care, even if they don't presently, they have to now cover these procedures or what have you now, even if they don't offer it anymore. Correct?
Correct. Yeah, and if you want to refer to a specific provision of the bill, I'm happy to walk through it. But what you just said is, in so many words, correct.
So let me see, and I'm going to point to some language here. Can you explain to me this? It's on page 3, on line 26. That paragraph that says, "This chapter applies to coverage under a group health benefit plan provided to a resident of this state, regardless whether the group policy, agreement, or contract is delivered, issued for delivery, or renewed in this state." Can you explain? I mean, that's confusing to me. Can you explain exactly
Sure.
what that means?
Yeah, let me help try to make sense of it for you. So this, you're on page 3, line 26. This is section C. So basically, what this covers is a situation in which you can have someone move from another state into this state, but they're still covered under the same insurance company, or they're transferred from company to company or a different department in their company. This simply ensures that whether that person had an insurance contract that was entered into outside the state of Texas or not, that if their contract with the insurance carrier allows for transition coverage and provides for transition coverage, then they also have to provide for the detransition coverage as well. It simply it doesn't really matter, I guess, where the location is.
So is that, do we do that in other areas of healthcare coverage in the state?
I'm not advised.
So this would be where somebody, like you said, let me just make sure I understand, because it's a little bit hard to hear. But so you're saying this is someone who received these services or procedures in another state, and now they've moved here to Texas, maybe because they want to take advantage of this if it becomes law. Then they're going to be allowed to come here and get this coverage with their insurance, and now their insurance company is going to be required to provide that?
Representative Gonzalez, I'm going to be really careful and committed to keeping
Sure.
our dialogue on the bill itself. I want to remind.
That is the bill.
I want to remind you and the members who are listening that an insurance contract it's a private contract between an individual and an insurance carrier, often through an employer. Mm-hmm. And all we're saying is that if the insurance company says, you know what, we're going to provide coverage for a gender transition treatment, then they also have to, whether it's at that time or later or in that place or another place, they also have to provide coverage for detransition coverage. Now, if an insurance carrier says we want out of this altogether, we're not going to provide coverage for transition or detransition, then this bill doesn't affect that. They can still do that.
I mean, well, the language in here says that they will forever. I mean, even if they've ever offered it, they're going to always be. They have to pay for these services, and even in the way that I read it is that even if the person wasn't enrolled under that with that insurance, I mean, look, if a person, let's say I'm enrolled with Blue Cross Blue Shield, and I decide to get some.
Representative Gonzalez, if I could stop you, I want to hear your question. I want to be careful not to name specific insurance carriers.
I'm sorry.
So let's just say Company A.
Company A. Let's say I have Company A, and Company A, I get. I don't know. I mean, I know there's limit. That's another question I'll ask. But let's say I get, some kind of treatment of my transition treatment, and then, or let's say that my insurance did not cover it, and I paid for it out of pocket, right? And then I get health insurance later, and I decide that I want to detransition, right? Or if maybe let's say I had some kind of adverse effect, and now I have health insurance, and let's say that my health insurance covers gender affirming care, right? Is that insurance company going to have to pay for that, even though they didn't pay for me to get it in the first place? That concerns me if they do, because the way that I read it, they will.
I think that the language of the insurance contract matters in that case. What you've just described is a hypothetical. The key words of the hypothetical you just mentioned were you paid out of pocket. Okay, these are the words you just mentioned. You paid out of pocket, not you, but the example you used, out of pocket for a transition coverage. And then later are enrolled in an insurance plan where they provide detransition coverage. My argument as an attorney would be that yes, they have to provide detransition coverage to you, but if you were insured at the time of, track with me here, if at the time of a transition procedure you had an insurance company that did not cover transition procedures and you decided to pay out of pocket, then at a later time that same insurance company would not be required to cover detransition coverage. This is truly about, again, it's very, very simple. Insurance company A, if they provide gender transition treatment, they also have to provide detransition treatment. They cannot, again, take you to the dance and not be willing to take you home.
So that would be regardless of whether you change insurance companies from, at starting point to end point.
Yeah, I mean, people do that all the time, and those are, I don't have any specific examples right now, but there are many examples in which one insurance company might offer better coverage or coverage for something that another insurance company might not offer. And those are all private discussions that I believe that the government should largely stay out of. That's probably a separate conversation for another time. But if an insurance company decides that we think it's good for our insurance company to cover transition, then again, under the law, if this bill passes, they would also have to provide that detransition coverage.
Even if that insurance company doesn't offer the same services. So let's say, like you said, insurance one offers only this I don't know. I mean, this specific type of treatment or procedure, let's say. And then let's say this other insurance offers less, right? Or they have one that offered less and they choose to get an insurance that maybe offers more. That insurance company, are they going to have to pay for the detransition care even though they don't currently offer that same particular treatment or procedure just because this person had that treatment or procedure under a different insurance? Does that make sense?
Not, to be honest, not really. I think there's a million hypotheticals that we could discuss about coverage A versus coverage B, moving insurance companies, getting better coverage. I mean, I believe in a free market where an individual should be able to shop more, and that insurance companies should be able to compete, and that we should have more options. And that's probably another conversation for another time, and I hope that in this body we can have it at some point. But that is beyond the scope of this bill in front of us now.
I just don't think that it's the responsibility of an insurance company to have to pay for services that don't even offer their current insurance at that point. Because now you're adding these mandates on these insurance companies to have to cover these services that maybe they don't even offer to their insureds at the moment.
It's pretty sad to hear. It was pretty sad to hear the heartbreaking, gut-wrenching stories
Who
of an
did not-
individual. Hold
Sorry,
on.
I'm sorry.
Of an individual where their insurance company says we're going to provide in some cases $500,000 of coverage for you to get all these gender transition treatments and in some cases surgeries and procedures that in most cases irreparably change the structure of their body and their chemistry. And then they come back a few years later and say, wait, I want to go back home. And insurance company says, tough. We're not paying for it.
And I don't believe we heard testimony to that effect.
We did.
There was-
we absolutely did.
There was one young lady that was the only one that was from Texas who actually
Well, it doesn't matter to me where they're
was
from.
already 22, right? I mean, and I don't believe that was even covered under insurance. They sued the doctor. That's another remedy. A person, if it's something that, let's say it's a botched surgery or something like that, I mean, you have the option of suing the person who did the treatment on you if you have an adverse effect.
I'm not trying to well, I'd like to, but with this bill in front of us, I'm not trying to change your heart and your mind on this, Representative Gonzalez. I'm going to stick to what the bill does. I believe that it's the right thing for us for the public policy of this state to be telling our insurance companies that if you're going to do this, you got to do this. I think that's okay for us to do in this instance. And if you disagree, I sincerely respect your right to disagree.
Again, like I said, I mean, the issue is not about that these folks decided to detransition. I respect people's decisions.
Well, it really is,
right?
because in
it's
many
not,
cases-
this is about insurance coverage. This is
Okay.
about the fact that this will increase insurance costs because this is creating mandates. And I thought that the goal in our insurance committee is to decrease those premiums because people already can't afford their bills already, Mr. Leach. And so that's what I'm trying to get to. And
Sure.
If you think otherwise, then I mean, I'm talking about insurance coverage here.
That's exactly
And I
what
want these folks to be able to get the care that they need. I'm not saying that I don't, but it shouldn't be on the backs of everybody else.
it's not. That's. I think that's probably a misleading misstatement. But I'm not going to argue with you.
Look,
I'm not. I trust that your heart is in the right place on this, and we just simply disagree. I think that you said that the care should be available to them, but if it costs a few $100,000 for them to have a detransition procedure or treatment or therapy, and they cannot afford it, then I'm sorry, but they can't. That is not a possibility for them.
I mean, because look, right here I'm looking at the bill analysis. It says, this bill requires the health benefit plan to also provide such coverage to any enrollee who has undergone a gender transition procedure or treatment, regardless of whether the enrollee was enrolled in the plan at the time of the procedure or treatment. I mean, look, I think it's fair that if a person receives any kind of coverage or treatment while they're insured with Insurance A and they have an adverse effect, that insurance company should cover that. But if the person was not an enrollee under their plan, why should this other insurance have to pay for care that wasn't even provided while they were insured with them?
That happens all the time, as you know, as a member of the insurance company. That happens for any number of procedures and treatments.
Okay, so then why not extend it to other procedures then? Why just this?
I think I saw you, I could be wrong whether it was today or yesterday, but I think I saw you vote for an insurance mandate earlier today or yesterday, which you have every right to do. There's some insurance mandates I vote for. There's many that I vote against. I believe that in this case, an insurance mandate for these type procedures is good and right and prudent and necessary for this growing population of Texans.
Mm-hmm. So you don't believe that this will increase insurance costs by adding these mandates when these insurance companies do what? Okay, sorry, scratch that. Do you know what kind of gender transition care is currently is provided under insurance? Do you know what type of care that is considered gender transition care is currently provided under insurance plans?
I know, yes, I do. I'm not sure I can speak to them with a level of sophistication and experience that someone like Dr. Oliverson or Dr. Bonin or Representative Howard could speak to them. But yes, I'm generally aware of what goes into transition treatments and what that includes.
The gentleman's time has expired.
Motion to extend time, please.
Members, you've heard the motion. Is there objection? Chair is none, so ordered.
So generally, what would that be? I mean, what would that be? I mean, because I'm not too familiar with, what that is under an insurance plan.
Sure. So it can, in some cases, include hormone therapies. It can include medical interventions. It can include surgeries, which I don't think we need to go into detail about what that means, but there's children in the chamber, and I want to
My understanding
respect
is
that. But look, I think we all know what is included in gender transition treatments and surgeries, and
because my understanding is that those types of like surgeries that you speak of, folks have to pay out of pocket because they're considered a cosmetic, unless it's tied to something medically related.
That is not
unless they
accurate.
find that you're having some kind of other pain and they have to, but it's not based on being somebody who is transitioning or somebody who's transgender. It's based on a medical condition.
So, with all due respect, that is not accurate. There are
Okay.
two major insurance companies in this state, one of whom just in September of 2024 set forward a medical policy entitled Gender Assignment Surgery and Gender Reassignment Surgery with related services. Another insurance company just this past year in January of 2025, a few months ago, issued a new policy called gender dysphoria treatment. There's many examples of insurance companies that are, in fact, most of them are. This is under guidance directly from the Affordable Care Act, where most insurance companies here in Texas and across the country are providing gender transition treatment coverage.
Thank you. I'm going to let some of my other colleagues ask questions. Thank you.